Right, hello, this is Dr. Riley. Today we're going to be talking about the medical treatment of autism, some things that are safe. Certainly, as you know, autism has been increasing, that it's gone up a lot. And when I had all black hair, this was, very rare, like around 1 in 1,000. And now it's like 1 out of every 20 boys that I see actually has autism. And the problem is, what are we going to do about this kind of stuff, right? It's the kind of thing that usually these little guys, they're pretty small, right, to have all these kind of problems, right? And what we want to do is we want to just try to see if we can figure out something that that we can do that's going to be safe for a 2-year-old kind of kid, right? Now, one of the things that happens, or at least happened to me, is I'd be seeing these kind of guys, and it was crazy, right? That they would I would see them, I would just give them a script to go see somebody. They would do their stuff, they would get them therapy. So I really feel like I was helping them, right? So really, if you want to kind of change things, you have to change, right? So this is really what I'm kind of going to be talking to you today is that what kind of changes can you do to what you're doing right now to help the kids more than we're actually helping them, right? And one of the fundamental things that's happened in the last few years is to realize that the mitochondria are at the root of all this kind of stuff, right? So when we find out the root cause of a problem, then we can actually more efficiently attack the problem. And there's different things that we could do to attack this. Now, I think that by now a lot of people have learned about leucovorin, which is one of these things that allow the mitochondria to work a little bit better. Perhaps less commonly known is the effect of things like L-carnitine, omega-3 fatty acids, and dietary changes in terms of helping the health of these kind of kids. And so that's usually what we attack. And usually when I see them, I have a more kind of, I guess, sophisticated way of attacking this kind of stuff. But I don't necessarily need everybody to be doing what I do. I think that what we should start though is starting to think about doing things like the FRAT test and other kinds of tests, things that people are familiar with. A lot of these guys are going to be low, and a lot of the things you feel comfortable taking care of, like iron and things like that. And just to test, right? Because it has definitely happened to me where I start doing some of these evaluations that, quite frankly, before I thought the developmental person was going to do, but they did not, right? Like doing genetic testing and checking things like thyroid and things like that, very basic kind of things. And they come back positive. They unfortunately come back positive. There's definitely mitochondrial panels, which I could teach anybody that they want to know about these kind of things. But these things are going to guide our plans, right? We're going to discuss with the patients first what we're going to do. So that creates a visit. And usually we talk about the values of doing the FRAT test and then checking for carnitine, checking for omega-3 fatty acids. And then we discuss with them changes in the diet. And even though the FRAT test is not something that people are familiar with, it does come back positive 70% of the time, which 70% is a lot of percent, right? And this is usually one of the things that proves to them that they have an autoimmune disease, right? So if you have one autoimmune disease, you can have more autoimmune diseases. Just this week, I've seen a few kids where they had positive the GAD65 antibodies, which is one of these antibodies that you see before you get type 1 diabetes. And unfortunately, is much more seen in these autistic kind of guys. So it is something that you have to check at least for the FRAT, because this will guide our treatment. Because a lot of times we get the test back, it'll tell you what kind of flavor that they have, but certainly it'll kind of more tell us that they're going to fall into this group where we see life-changing results when we treat people with leucovorin. Leucovorin is basically going to be used by us to circumvent the blockage that we see from these antibodies. These antibodies are blocking the main route which folate goes into the brain. And we do know that we give pregnant ladies folic acid, and we do this so that way we can prevent the baby from having brain problems. Well, we can prevent our autistic kids from having brain problems by giving them folinic acid. Folic acid, for some reason, which I'm not going to talk about today, actually is perhaps not so good for these guys. And so we're going to have the dosing here. And And the dose usually is 2 milligrams per kilogram per day. Usually 25 milligrams twice a day is the maximum dose. But we usually don't start like that. We usually start with either 5 milligrams or half a tablet twice a day, or usually once a day. And then we make it twice a day. Then every few weeks, we increase it until we get to their target dose. Their target dose is 1 milligram per kilogram per dose. And the maximum dose, if they're bigger than that, is usually 25 milligrams twice a day. I would tell you that, guys, the only problems I see that they get into are usually they can be activated. But a lot of times, if they're activated, is because they're low in other vitamins, and that the person who gave them the leucovorin didn't realize that they were low in vitamin B12. All these kids need to be high in vitamin B12 for leucovorin to have its best effect. They need to have normal omega-3 levels for leucovorin to have its best effect. They need to have no deficiencies in a lot of the other vitamins that are associated with normal folinic acid function, right? So this is an issue, right? So for example, if they're low in carnitine, which is one of these things that allows the brain to work at full power, then yeah, the leucovorin is not really going to do what it's supposed to do. Carnitine is found in meat, and a lot of these kids are not eating enough meat. And I definitely have seen kids where they start talking just because I started them on the carnitine, right? So we can check carnitine levels very easily. It's covered under Medicaid in New York State. So it's not one of these things that's so hard. And definitely we can give kids carnitine and it's covered by their insurance. Usually there's the carnitine is something that again, we can give 25 milligram per kilogram per dose or every day. That I tend not to ramp up. That I tend to just give them whatever they need, and then that's it, right? Because they don't really, I don't really see a lot of problems with this. The only thing I see with the carnitine is sometimes if they're really having a lot of dysbiosis, then sometimes they might have a little bit loose stools with the carnitine, but then you would just give them half the dose and that would be fine. And then you would slowly increase it. Carnitine is found in every kind of meat, so usually people don't get diarrhea from meat, but the carnitine, the liquid that's usually covered by Medicaid, that usually has a little bit of sugar in it. They do make a sugar-free version with Splenda, but a lot of my guys, they're not doing so great with Splenda either, right? So usually the liquid is in Surescripts. It's 100 milligrams for 5 ml, and usually what we do is we give 25 milligram per kilogram per day, or excuse me, per dose. That usually tends to be what we're shooting for, right? But really just trying to get them to eat more meat because that's usually the problem. Omega-3 fatty acids, that stuff is good for everything. And usually it's the kind of thing what we try to do is try to get them to eat more fish, ideally. But if that sometimes is unreasonable because the parents hate fish, right? So they never ever gave their kids fish, even though the AP recommends kids to have fish starting at the age of 1, right? But it is the kind of thing that what we can do is we can always give them omega-3 supplements. So usually the omega-3 supplement that I recommend for people I have on these slides are usually from either Carlson or from Nordic Naturals. Usually, even if they're a little kid down to 2 years of age, they usually can handle a gram. This usually is about a gram for every 5 ml. And that usually does a good job, right? These two brands are well known for purity and they're usually third party tested. And especially the Carlson brand tastes really good. So that usually is good, right? So these are the three things that I think you'll get the most bang for your buck if you use for your autistic patients, or at least you can try. You don't even have to do any tests, quite frankly. You could really start all these things if you wanted to. Just the only thing is that if you're using folinic acid, because it's activating, I usually would try to give them a smaller dose before I gave it, like start with half a tablet, half of the 5 milligram tablets. And I would do that for 2 weeks, and then I would give them the other half in the afternoon. So like one half a tablet in the morning, one half a tablet or in the afternoon, and then slowly increase the dose to the target dose. So that way we don't get ourselves into trouble, right? Now, usually nowadays, I tend to give kids a certain mitochondrial support vitamin called Spectrum Needs. That seems to have a lot of the little vitamins, and I find that it actually gets rid of a lot of the side effects that people get from when they start the leucovorin because it has all the other little vitamins that are inside their body. And then you can do that without actually having to do a lot of tests So you don't have to strain your brain to look at all these kinds of things. Usually it's the kind of thing that the spectrum needs is actually has randomized controlled trials that show that it actually helps, especially with socialization. But it's used for other mitochondrial problems, and it seems like it works very good. And it usually has a pleasant taste, either lemon or berry flavor. Usually part of the dietary recommendations that we give are very simple. We Frat test positivity is related to milk. They've done studies where if somebody is positive frat test and then you lower the milk that they're drinking, they'll actually see the amount of antibodies their body produces goes down. So it seems similar to celiac disease, where if you take away the wheat, their antibodies go away. If you take away the milk, the antibodies found in the frat test go away. So it seems 100% to me that you just don't give them any dairy. Um, when I do my really thorough blood tests, they're always low in meat. They're never low in vegetables. They're never low in fruit. They're always low in meat. So meat for breakfast, meat for lunch, meat for dinner, meat for snack. That's usually what we want to do. The best meat is usually fish, but certainly egg yolks and liver and heart and all these other kind of high quality nutrition packed meats are usually good. And but really, even something like chicken breast, which is sometimes not really the best, even that is better to eat that than to eat, the healthiest vegetable. But it's usually the parents are killing themselves trying to get these kids to eat vegetables when really what they need is more meat, right? And especially any kind of fatty kinds of meats, they tend to have all these things like choline and the omega-3 fatty acids, all these things that they're usually typically low in, right? So usually these kids, you don't have to buy the most expensive lean cuts of meat. We're usually needing them to eat, you know what I mean, like more fat so they aren't made of the chicken and things like that. So usually what I say to them is like, yeah, try to concentrate meat, eggs, fish, every single meal, half the plate, meat. Usually good to have vegetables. Try to eliminate grains, right? Usually when you give them, these kids usually don't do well if you eliminate all carbs. So it's usually good for them to have some carbs, but usually it's like not grains. It's usually root vegetables, plantains, things like that. But since these omega-6 fatty acids that they see in corn oil, olive oil, soybean oil, canola oil, they're all crap. So we try to avoid those kind of foods. So we try to avoid the foods of other people. So that way it's the kind of thing the kids can actually grow up to be healthy. And those kind of things kind of help us to be better. So unfortunately, the AP actually knows all this kind of stuff, but they don't want to change, right? So this tends to be one of those kind of things where it's usually going to be the younger doctors that change all this kind of stuff, because the older doctors, after a while, your brain hurts whenever you try to do something new. So you don't want to do anything new. But I would encourage you guys to do new things, right? Because the only way these kids are going to get better is really if we make changes. And to tell you the truth, even if you make some of these kind of changes, which are not the biggest changes in the world, I would tell you every time you make a change in the right direction, the kids always get better. To tell you the truth, this is actually a thing that you could talk to anybody that works in my office. They all seem to get better. And usually these are things that are actually going to be good. And you could see there's nothing more rewarding than when the kid was not talking and they come to you and they say they were talking. So I would do all this kind of stuff if I were you guys. And if anybody wants to learn a real full, thorough kind of workup, I'm very happy to teach. Right. I think that's everything. Have a good night.